70-year-old male patient presented with chronic dry cough and progressively worsening dyspnea over the past several months. He has worked indoor of his job most of his life and does not own any pets. Physical examination vital signs are normal. Chest auscultation reveals inspiratory crackles in the base of the lung and digital clubbing. And the reminder of the physical examination is unremarkable. HRCT is shown. Which of the following is the most likely diagnosis? Idiopathic pulmonary fibrosis, hypersensitive pneumonitis, asbestosis, or bronchiectasis? So he's 70-year-old male with chronic worsening dyspnea over several months. So there is no occupational exposure, and does not own any pets. And on chest auscultation, there is inspiratory crackles and digital clubbing. And as you can see on the HRCT, this is a typical picture of usual interstitial pneumonia pattern. So the answer is idiopathic pulmonary fibrosis, hypersensitive pneumonitis. There has to be some exposure, and we said that he's indoor of his job, and there is no occupational exposure, so asbestosis is unlikely. And bronchiectasis, they will have productive cough. Here he has dry cough. They will have fever and chills often. They will have very productive sputum production. So this is also unlikely. So here is the key again. He's elderly male, history of chronic dry cough, progressive dyspnea over several months. There is digital clubbing, inspiratory crackles, and the HRCT demonstrate usual interstitial pneumonia pattern with reticular opacity and then a honeycomb appearance. So the hypersensitive pneumonitis, they will have repeated exposure to inhaled organic antigen, and usually they would have ground glass appearance, mid to upper lung predominance. Asbestosis will have significant occupational exposure like shipbuilding, insulation, construction worker. They might have pleural bleeding, and in the absence of exposure is very unlikely. Bronchiectasis usually present with productive cough, not dry, and they have very prolonged sputum production, and they would come with recurrent infective exacerbation, and they might have fever and chills as well, so this is also unlikely. So the learning objective is that idiopathic IPF is a diagnosis of exclusion, so you would rule out occupational exposure, you would rule out environmental exposure, you would rule out drug-induced interstitial lung disease, you would rule out autoimmune disease. So once all of these are excluded, then the diagnosis is IPF. Usually they come in male adults, usually 60 years old and above. They present with chronic dry cough and progressive dyspnea. They have inspiratory crackles, so with inspiration, and they may present with digital clubbing. And the HRCT finding is usually pattern. For more information, also watch the previous video that we made about IPF to learn more about the clinical features, diagnosis, and treatment.